Good afternoon, everybody. Mine is the last name on this slide, Dr. Sam Shahpar. I'm a physician at the Shirley Ryan Ability Lab, which is one of the rehabilitation institutes down the street. We used to be called the Rehab Institute of Chicago. I've been there for probably a decade and a half. Fortunately, unfortunately, this is not the first time I've given talks to groups of patients and caregivers of varying diagnoses. One of the things I thought was important as I've given these talks, I've learned a lot from patients and families during my time individually practicing and seeing them, and also coming to meetings like this. I have a couple of my senior residents who are about to be going out on the world on their own, but are interested in dealing with individuals with varying types of tumors. They have a lot of expertise. Luckily, where we are affiliated with the hospitals around, and we get people from all over the world, we see a lot of rare tumors that come from a rehabilitation perspective. What we're going to try to do in a very short period of time, we can probably do a whole day conference on things that we do, is give a brief overview of what we are. And I'm a physiatrist. Most people who are physicians don't know what a physiatrist is, so most people out here probably don't know what it is. Give you a brief overview. I got a little show and tell, and then I want to kind of leave it open some time for questions, because I know, especially with this patient population, it's quite variable of the things that people experience. And I think what we want to be able to offer today is give some knowledge about us and potentially have access to people like us. But also there are some things, if you don't have access, depending on where you live and where you are, that you could still do to advocate for yourself and to try some things on your own. It's not always that you need to see someone with my specific expertise that isn't close by. So that being said, I'm going to introduce Dr. Lydia Henderson, like I said, one of our senior residents. She's going to give a brief overview to start and pass off to Dr. Kelly, and then we'll open it back up.
Okay, thank you for the introduction, Dr. Shahpar. So like you outlined, we've got a couple of objectives for you today. We hope to introduce, again, physiatry, the specialty that nobody knows what that is, and explain a little bit more what it is that we do, so that whether or not you're interfacing with us or people who have access to similar resources that we provide to patients, you kind of know what it is that's out there in terms of options for you and what to ask for and advocate for. And then we hope to describe some potential functional issues that can affect people with desmoid tumors, reasons that they would be seeing a physician like the three of ourselves. So what is physical medicine and rehabilitation? It's called PM&R for short, if you've ever heard that phrase. The doctors within PM&R are called physiatrists. We three are examples of physiatrists, and we focus mainly on the medical side of improving patients' function. So we work on prevention on the front end, from the time of diagnosis to during the treatment process, and then following the treatment process when you're in that more recovery phase. And we treat those functional impairments that arise at every step along the way, whether permanent or temporary. And then our aim is to kind of align with exactly what the patient's goals are. If I want to be able to do X, Y, or Z, those goals become our goals, and then we try to work with you to achieve those goals together. So our goal is to restore functional ability and then to restore quality of life, again, within the scope of what the goals of the patient are. Who should see a PM&R doctor? So that's people with difficulties of many different kinds, right? So the one that people usually comes to mind is people with difficulty walking, standing, endurance, getting to and from the grocery store, walking around your house, going to visit family, getting in and out of Ubers, mobility-related difficulties. But it's broader than that as well. It's people with difficulties communicating, swallowing, just doing the things that you want to do on a day-to-day basis. It's as simple as getting dressed in the morning, using the bathroom, cooking, cleaning, like I mentioned, grocery shopping, all of those things. If you have something that you are having difficulty doing and would like to address that and figure out a better way to do something or to make it easier, that's when our role kind of begins. So basically this phrase, if I want to do blank, but I am not able to do it, that's when we start to kind of enter the foray and try and help out. We address lots of different types of issues as physiatrists. So pain, weakness, depending on where tumors are located, they can cause local or referred or different types of pain, neuropathic pain, compressive pain, postoperative pain, weakness from the tumor itself, or surgeries or other treatments that you've had can all arise as you're going through that diagnosis and treatment and recovery process. We address loss of mobility, like I mentioned, and those what we call activities of daily living, or the things that you do in your day-to-day life that may or may not become difficult as you're going through your treatment. We also work with patients in wound healing. We have a special niche kind of carved out in the world of medicine for bladder and bowel function. Very few doctors care as much about bladder and bowel as we do, but we genuinely do care. Sexual function, and then social support, all of the things that can play into your function and your quality of life that happen on the periphery and then affect you. We care about those as well. And then if you have trouble returning to work or doing certain activities at work, we address those as well. So vocational concerns, financial or economic, money management, those types of concerns, all, again, play into your function and play into your quality of life, and so we care about those as well. And we work with you to help improve them from the medical perspective. So the doctors themselves, we have lots of different avenues that we can provide medical help for these functional goals. We work with you for symptoms or for medications for symptom management. If there are things that, like I mentioned, pain, weakness, alertness, all of these types of things are things that we can help with medications, sleep, those types of things. We can prescribe and adjust medications to help with those functional goals. We also are kind of like the quarterback on a football team when it comes to coordinating the larger rehab team that works with patients who have these goals. So the physician kind of coordinates amongst therapists and other different team members that I'll go into in a minute. And then there are different types of interventions that we as the physiatrist can perform. This includes, but is not limited to, different types of injections or treatments for tight muscles or pain. And then we'll give you some examples, and we brought some examples here today of different medical equipment that we can use to help achieve goals. And so we prescribe that equipment when you first are trying to decide what's going to be most helpful, and then as equipment wears out over its lifetime, we're the doctors that re-prescribe it when you need replacements. So this picture I like is kind of a good example of the ideal setup for rehab and the whole rehab team. So at its best, that's the patient in the middle, and then many, many team members that we as the physiatrists work with to try and help the patients out. So it's ourselves, the physiatrists, but it's also the different types of therapists. It's dietitians, it's communicating with the different other doctors who are taking care of the patients and their care. So oncologists and other physicians, we're interfacing with them to all kind of communicate and work together to try and improve quality of life and hopefully all achieve common shared goals. Okay, so at this point, I'm going to turn it over to my colleague, Dr. Kelly.
Thank you. Okay, so I think, like Dr. Shahpar said, this is kind of broad strokes, a very high-level overview of the types of things we do. We like to talk about kind of the tools that we have in our toolbox, and some of those common tools that we talk about are two of the most common therapies you may have heard of. Maybe your loved ones or yourself have been involved in these, are physical and occupational therapy. Physical therapy in broad strokes works on things like your balance, your strength, your endurance. Occupational therapy, on the other hand, works on things that we like to call your activities of daily living. So things like getting dressed, using the bathroom, showering, helping you get set up with adaptive equipment. So if desmoid tumor is affecting you and making you stiff, making you weak, making it harder to do those things you need to do, physical and occupational therapy can work together and help you to live well and to move well and to stay as active and independent as possible. And then there are other different types of therapies which are maybe a little less common, but that we like to use as physiatrists to help people live well in other areas of their life. So one type of therapy is recreation therapy. So recreational therapy help with activities of leisure to help you pursue and continue to engage in those things that you're passionate about. Let's say you're an artist or you're a musician or you're an athlete or you would like to be, but you're finding that desmoid tumors are making it a little bit harder to engage in those things. Recreational therapists can help with adaptive ways that you can be participatory in these different activities. And then vocation counseling, Dr. Henderson touched on this a little bit. A lot can change when you have a diagnosis of a desmoid tumor, and your ability to stand at work or to sit for long periods or maybe to do the types of things that you used to be able to do may have changed. So how can you get access to some of those resources which can keep you engaged in these passions and in your employment and give you other resources that can make things a little bit easier to navigate that while you're at work. And then orthotics we'll talk a little bit about, and we have some examples too. They're bracing specialists. So if you're having trouble with support in a limb or a joint and things are weaker in one area or another, and you need a little bit extra safety in that regard, you can use the orthotists, who are the specialists in orthotics, to help make life a little bit easier. So all of these different therapies are geared towards keeping you active in your passions, in your hobbies, in your work, so that you can live as meaningful and as fulfilling as a life as you can. And this slide, I think, is a good way to approach how we as physiatrists would talk about evaluating a patient. So obviously, there's a lot of different ways that desmoid tumor can manifest. No two patients are going to be the same, and we don't treat any two patients when we're evaluating them as the same. We like to take our knowledge of the lymphatic system, of the nervous system, of the musculoskeletal system, of the tendons, of the joints, and treat and tailor our toolbox and our therapies and our prescriptions towards each individual patient and come up with a personalized rehabilitation plan so that you can live as fulfilling and meaningful as a life as you can as the individual. So it's not a one-size-fits-all type of system, but there are certainly some things that you can prescribe and that you can think about that are more accessible and that can make it a little bit easier for you to get around in your day-to-day life. And some of those things that we talk about are things like ambulatory aids or mobility aids. So this kind of runs the gamut. You have everything from a cane to a wheelchair, but the point is that, again, it's not one size fits all. So the idea of these different types of aids is that you can stay active and that you can conserve that energy. Maybe mobility is a little bit harder than it used to be, or it's more painful than it used to be. How can you save that strength and that endurance for the things that really matter to you in your life? And these aids are one way of doing that. And then there are other types of environmental aids. So things that maybe were a little bit easier before are becoming a little harder now, like getting into a tub bench or into a tub to take a shower, getting up a set of stairs. Maybe a lower toilet is a little bit harder to get down on and off of. There are different options that we think about for making your environment work with you instead of you constantly having to use that energy and that momentum in your day to help or to fight against your environment. We'd rather give you options to help make that part of your life a little bit easier. And then, of course, we have adaptive aids. We'll talk about these a little bit more in a second. But adaptive aids are just little adjustments that you can make, things like reachers or grabbers or long-handled shoe horns, other things that make conserving that energy or avoiding stimulus of pain in whatever way that may manifest for you a little bit easier to tolerate as you kind of go through your day-to-day. And then the last piece we talked a little bit about is orthotics. And again, these pictures and these images, we could talk at length about each one and how we think about what one is best suited towards an individual, but I don't think that that's as important at this point. I think just knowing that there are a lot of different options, a lot of things that we as physiatrists think about as being in our toolbox, whether it's physical therapy, occupational therapy, if you're thinking about if somebody is stiff or weak or they have pain or they have weakness and it's hard to move their arm or their leg, there are all kinds of options that are available to you. Now, these are options that we use commonly and we think about all the time, but it's not something that is necessarily like exclusive to physiatry. These are options that you can help advocate for yourself. If you have an awareness that there are other tools around and that you can ask your provider, hey, would physical or occupational therapy help me to stay active and independent? Would a brace help me to be a little bit more mobile? Would this adaptive device help me to do some of those things that I really care about and want to do in my life? These are all things that you can think about and talk about. A lot of these things you don't need a prescription for. Some of them you can get online, which I think Dr. Shahpar will talk about. But in broad strokes, we like to talk about the individual. We like to have a personalized rehab approach and understanding that no two persons are going to be the same, and understanding that how we can adapt and conserve your energy and make your life as fulfilling and meaningful as possible with your work, with your mobility, with your activity, with your independence, and with your passions. That's what we as physiatrists try and do every day. So I'll throw it to Dr. Shahpar to give a little bit more feedback, and we'll talk about some of these devices.
Can you go back to the assisted device slide real quick?
Yep.
So a few things that one more, right? The other way. Assisted device, the one with the walker. So my experience, a lot of people get some of the stuff you saw on the screen on their own. I'm having issues, let me get something. The problem that we often see is not that anyone's doing anything wrong, but people look at that part and say, I'm not as bad, let me get the one that doesn't look as bad, which is the straight cane. And then I'm not too bad, I don't need that last one.
but this isn't in the degree of disability. Every individual may be appropriate for one versus the other, depending on their balance, their strength, their pain, and maybe they're using the cane in the wrong hand, and maybe it's the wrong height, and maybe this type of walker is better. But I think not uncommonly, you see the power wheelchair and you say, I don't need that because I can do certain things. But really that assessment is not, this is not, oh, the more problems I have, the X device I have. It's very individualized. Dr. Kelly and Dr. Henderson mentioned a few things that we talk about in terms of function. And a lot of times when people go through an illness or surgery or treatment, they want to be as active because they want to keep up and they want to keep doing things. But I often need to tell my patients, just because you can doesn't mean you should. Meaning, I want to put on my pants and my shoes the way I always did because it helps me feel normal and I feel like I'm being active. But sometimes that's not the best use of your energy, or maybe that's triggering some pain or other aspects. And that kind of leads into adaptive devices. There are probably some people in the room who are my age or older that have ever seen a car without like power assist drive to turn a wheel. Has anyone had to turn a wheel that didn't have that? That is a technology or device that in order to go a couple feet that way, you really had to push. When I was younger, I got a lawnmower that had a little push assist to go up, a hill, the same thing. And so we're allowed to get supports, and that doesn't mean you're not going to be as functional independent. That's a tool to allow you to get better. And a few of the things that Dr. Kelly's has mentioned that I want to pull out because I think it's really important that you advocate for yourself. Most likely you have all seen a practitioner that's never seen your diagnosis, and you will again. And so really important that you may advocate because they say, I don't know what you need. I haven't seen anybody. And yeah, you may see the specialist. But when it comes to function, it may be a therapist that you get referred to because you're having a problem. They say, I don't know, it's this rare diagnosis. I don't know what to do. But the structure is still the same. And so advocating for yourself and having a brief knowledge of what can happen is important. So I'm going to just hold up and then we can maybe pass around. I know we're a little maybe tight on time to the break. Dr. Kelly talked about AFOs. These are ankle foot orthoses. All right, so it could look like this, it could look like that, it could look like a lot of other things. This is commonly used for what people call for foot drop or for knee stability. And so I'm gonna show off my legs a little bit. You can see my leg here, and if this is in an L, it's gonna give me support to hold my foot up, but it also will prevent my knee from buckling. It will give my knee support too. So some people who have weakness or pain, it can give some more support. This is what we'd call a solid, and there's ones that have a different profile. There's some that, will have a hinge. This will also help give ankle support. It comes in front of those little ankle bones. And so this is something that we work with the orthotist that we'll talk and specifically prescribe based off what we assess. This one was custom made. This is what we call off the shelf. This is a carbon fiber one. A lot of people like this because it's a little cooler looking. It's not as bulky. It may fit in the shoe easier. But you see, this may have a different function. It may give a little bit more spring, but it doesn't give someone with medial lateral instability. So if your ankle is off, it may not be the appropriate one. And so that's the part of just because you have a brace doesn't mean it may not be the right brace for you. This is a simple, we call it WHO. The bracing is really where it covers wrist, hand orthoses. So if someone had surgery or discomfort or they have tightness, sometimes we use this to stretch it out. This would be what you'd probably consider a resting hand splint. So if you're sleeping, something there, obviously this isn't very functional. These next products are really stuff you can get over the counter and buy on Amazon, probably get at your house tomorrow or today, depending on where you live. I think a few things are really, really helpful, even if you don't have whatever diagnosis we're dealing with, people with bad backs and hips and arthritis, which we all can get. Dr. Kelly showed a few of these. This is a sponge on a handle, right? So similar to a handheld shower. This seems stupid and silly to some degree, but it makes it a lot easier that you can be independent because maybe my back hurts or I have difficulties reaching. I can catch my foot, I can come to my back, I can do other things, and it allows you to be more independent versus you can't reach certain areas. That same thing goes with this. This is a mirror, right? There may be places that you can't see that you can use to look at different areas, especially if we're talking about surgeries or wounds or other aspects. It's always nice to have family and friends and caregivers. We have people with bowel and bladder dysfunction. We have people with other aspects. It can be used for a lot of different things, hopefully not spying on anybody. But
You can reach around and help to make it independent. Dr. Kelly showed a picture of this. This is something that people a little get confused. This is a leg looper. Say I have a tough time lifting up my leg. I can put this on my foot if I'm good at it, and then I can help pull and move it, especially with getting in out of bed. Again, a lot easier in leverage. I think everyone should have one of these. This is a long-handled shoehorn. Most shoehorns that come when you go to the store are like this big, so you still have to dig down anyway. It doesn't really help you. Here you can stand up. It can help with the shoe. So do you need to have a problem for this to be beneficial to you? No, it can help you in daily function. Does it take practice to use? Yeah. A few other examples. I think I've seen some commercials for these too and different ends. I think there's some that's like a stand, but these are called sock aids. And so you would slide your sock on, and then you put your foot in, and then you slide it up, and this comes out, your sock comes on. I think there's one that they can take your Medicare money of some online thing where you put your foot in a stand, and it's like easy to get your sock on. This is a harder plastic one, same thing, but again, for difficulties reaching over or bending or gauge independence, it's a little harder to get the hang of, but takes practice. A few other pieces. Elastic shoelaces. They don't need to be neon color like your grandkids or kids, or if you like neon, you can use neon. This looks like a regular shoelace. You can put it in fresh shoes, you can put something else, but then I can tie my shoe before I put it on, and in essence becomes a slip-on, right? And then you're not worried about bending over, tying your shoes, or becoming untied. And you can tie it tight and allows that. This is one, costs a short amount of money. You can get many places, but you can find it and it can help. This is called a rocker knife. I don't know if everyone's had any difficulties cutting anything ever in their life. I have. That sometimes is helpful. You can grasp this knife and cut as a rocker. This is primarily used, for instance, we see sometimes people who've had a stroke or difficulties with on one arm. Usually you need two hands, a knife and a fork to stabilize, but I can put on the plate and I can cut myself, right? Again, you don't need to have a disability or impairment to use something like this. I'm going to show these two. This is a bent fork, but this built up. If anyone was in school and ever had these like those fat pens or pencils that you can grab onto, the wider it is, the easier to grip onto. So even if you have arthritis or other aspects, you can hold on. This comes on and off, and you can put it on different spoons, forks, devices to hold on to. If you have problems with your hands and grip, this is something that will attach to your palm of your wrist, and then you can slide this piece in and then use your hand without using your fingers, and you can see on the picture here, to be able to use your fork and otherwise. We have a lot of people with hand or finger-related issues. So these are tools you can find online, but understanding which one would benefit you or otherwise sometimes takes a therapist or some guidance, but you can try these out. I don't really like Amazon, but Walmart, Target, places that provide returns, you can get stuff, try it out, and see if it works, and then return it. The last piece, I think, for my show and tell is this. Most people have no idea what this is. I could definitely use it. Your kids could probably use it, depending on how old they are. This is called a plate guard, right? It will snap onto the plate, so as you're trying to get a pea or anything else, or that piece of spaghetti that you need to push through, it comes and blocks your plate, so you can be able to use it. But especially for difficulties with your hands or mass or function, it's really, really important, especially if we think of someone who has surgery afterwards. You may have an arm or a leg or a body part. These tools may not be forever tools, but they're tools you can use. And so, as Dr. Kelly and Dr. Henderson mentioned, you guys are all different. We come with different aspects, and you're not just what your treatment is. You may have arthritis. You may have other aspects that we have to attend to of how to focus. So I wanted to show these. You can come up and look. I think we got a break coming up and answer some questions. But advocate for yourself. Even if people don't know what you're dealing with, talk to them and say, hey, is there anything that can be adaptive? Most occupational therapists or physical therapists will have an idea. They may not know about desmoid tumors, but they can think, right? Most people can think, and then they think how what I know applies to you as an individual, not just with the desmoid tumor, but anything else that's going on with your life. And this also goes not just if you can't walk or talk or go to the bathroom. If you have difficulties at work, if you have difficulties with your activities, all those other aspects are really important. So when we talk about function, it's not like I can put on my clothes. It's all the levels of function. I think we're a little long on time, but are we good? Any questions? I know a lot in a short time.
Yeah.
Sorry, quick question.
Yeah.
So thank you for that. So I'm currently in physical therapy right now back home, and my physical therapist told me she doesn't know much about desmoids, and we were working on improving core function. I don't know how much research is out there, so maybe this is for the other doctors here as well. If I'm trying to improve core function from having diastasis, and I have an abdominal wall tumor, will that affect how successful that can be? Because I am putting in a lot of work, so I want to see if that can affect that in any way.
So diastasis, I can tell you there's probably not any research specifically on desmoid tumors, but there is some data on people who have diastasis otherwise. And I think Dr. Henderson mentioned we see people with bowel and bladder dysfunction, sexual dysfunction. We actually see some specialists that see people postpartum. And actually during pregnancy, people can get diastasis. So depending on your therapist, sometimes, the specific activities and actions, if there's someone that has seen people postpartum and had diastasis, those are good therapists, but absolutely there's some data that we can improve core strength. Obviously, it depends on the degree of diastasis and other aspects, but making sure you're approaching it in the kind of assessing what your degree is and how to strengthen around it to make sure we're moving forward. You may or may not know sometimes there are surgical options for diastasis that people need to go to, but most of the time we manage conservatively, and sometimes we use things like binders or corsets or other things to help during the process of rehab. So it's not replacing getting stronger, but providing kind of external support similar to a brace may do. Anything else? I know, Dr. Henderson, you're interested in some of this population.
And I don't know what type of physical therapist you're working with, but it might be worth asking to talk with specifically a pelvic floor physical therapist because they tend to have more experience working with diastasis.
Thank you.
Another question?
Hello, thank you. I actually also go to PT several times a week, and although the PT is awesome, he admits wholeheartedly he knows nothing about desmoids. So he treats me as a traditional cancer patient, meaning that he shies away and does not use electrical stem, ultrasound, is questioning if we can do traction. Are there things as a desmoid patient he should or should not do as far as modalities?
So generally that ends up being somewhat of an individualized question.
Okay.
Historically, there's not anything specifically that you have a desmoid that exclude you from any of those interventions. The data on really any tumor, desmoid or otherwise, things like stimulation or ultrasound directly over a tumor or tumor bed can be, there's not data on it, but people aren't excited to do anything.
Right.
But surrounding tissues, if this tumor has already been resected, otherwise, that's a conversation that hopefully if you have your other physicians, like your surgeon or your primary, that say, we don't have any concerns, that should alleviate that. But intrinsically, the fact that you have that shouldn't give you the restriction on not doing X, Y, or Z.
Okay, thank you.
Any other questions? And I can leave some of this stuff out if people are interested for the next little bit.